So let's get on with the why we've all gathered today. There's been more people joining us as we've been sitting here. So this is good. We're getting into the great stuff here. So Dr. Dillon Browne, he's the Canada Research Chair in Child and Family Clinical Psychology and is the Assistant Professor in the Department of Psychology at the University of Waterloo. He's the principal investigator for the Whole Family Lab and is a registered clinical psychologist in Ontario with competency in children, adolescents, and families. His education, Dr. Browne completed his BA in Honors in Psychology at the University of Guelph, his Master's and PhD in the School in Clinical Child Psychology at the Ontario Institute for Studies in Education at the University of Toronto, and then for doctoral internship and clinical postdoctoral fellowship, Dr. Browne studied and practiced in the Child Trauma Research Program at the University of California in San Francisco. So this is the part I find most interesting is what he's doing now. Dr. Browne's program of research examines the influence of adverse childhood experience, ACEs, trauma, and socioeconomic status on human development and family relationships. He's also involved in the development, evaluation, and implementation of evidence-based interventions for children and families who are struggling with mental health and relationships, particularly in the settings of trauma and adversity. So I'm going to now turn this over to Dr. Browne. We are so glad to have you with us and are really looking forward to all that you are going to share.
It's a pleasure to be here. Just let me share my screen and then hope the right screen shows up for you. Can I get a thumbs up that is not the presenter view?
You got a thumbs up. You're doing great.
All right.
That's the one you want.
We're off to a good start. It took Catherine and I about 15 minutes to get that right. So this is some serious rehearsal we have going here. Anyway, good morning, everyone. It's wonderful to be here. I've loved hearing about the different initiatives that Erin Mills connects so far, and I'm excited for the Q&A period where we get a chance to talk a little more informally. As you can see from the title slide, and as Carol was saying, I'm going to be talking today about COVID-19 stress and families. We've been hearing a lot about children's mental health lately, in the news, and perhaps a little less about parents and even less about entire families. So I hope this talk will shine some light on how the pandemic stressors have been operating across the family system, and especially for parents with children, with young children, for implications supporting one another through this difficult time. Can adjust my screen a little bit here. Okay. So I want to start off with a little vignette, a story about a family. We can call them the Jensen Ramirez family. They're a blended family with both Victor and Helena having children from previous marriages. They love spending time at the park where the girls play on the playground or run ahead while walking through the woods. Shortly after the pandemic hit, Victor was laid off and has been on the CERB, now the EI benefit. Helena, on the other hand, is an essential service worker and has been working overtime to make up the difference so that they can pay for the rent. At home, Mary and Louisa are attending school online because Louisa has an immunodeficiency syndrome. And as a result, the family has been pretty strict with social distancing. Victor started to feel resentment around taking on the added childcare responsibilities, which he feels is impeding his capacity to find new work. In the last month, his weekly 6-pack of beer has become a 2-4. Helena reports feelings of exhaustion and burnout, in addition to a flare-up of her IBS. She also realized recently that it's been a few months since her and Victor were intimate together. In terms of the children, Mary has become anxious about germs, and Louisa feels like she's somehow to blame. Her and Mary have actually started arguing for the first time. Despite these significant challenges, the family has stayed committed to their weekly outings at the park. So my question that I pose to you is, where should services begin? So Helena's worried about the kids, but knows somehow that the difficulties are more multifaceted than that. If you were a friend, what would you suggest? So just take a minute to think about that. And as you probably gathered from the title of my talk, my argument today is that a whole family approach, such as family therapy, that pays close attention to the caregiver mental health and to family relationships is particularly warranted. And this comes from the central idea today. So here's one of our first takeaway messages. That is, children will be all right if the adults taking care of them are all right. So off we go. From the closure of school last spring to the summer at home to new routines this fall, it's been a very, very hard time. We know that. Many of you are undoubtedly feeling these challenges yourselves right now. I've had a chance to talk to Dr. Krista Gass from the Erin Mills community about some of the challenges that have been going on in the community in regards to COVID-19. What remains unclear, or what we're going to be exploring today, is how and for whom does this disruption take place across the entire family? And relatedly, while we're seeing differential outcomes for COVID-19 infection itself across subgroups of society, we still know relatively little about how the psychosocial stressors differentially influence families with different backgrounds and life histories. And in addition to that, given how recent the pandemic is, we're still kind of figuring out the best way to help people. You know, research does take quite a long time and an even longer time to get into regular practice. So the purpose of my talk today, our learning objectives, are really going to be to describe these pathways to resilience. So first, to describe the effects of COVID-19 on families, to identify the caregivers who are most vulnerable, and last but certainly not least, a few things that we can do to help. This is going to be based on a study that I've been running of over 500 families and 1,000 children. So why don't I just go right to the helping? Well, we need to know where we are in order to leave. In stressful times, and in my experience as a family therapist, I've been doing telehealth family therapy during the pandemic. Many families I work with report, this kind of diffuse sense of hardship and that things just aren't working. And by pulling out the magnifying glass, I hope that we can get some insight into where our own difficulties lie and find ourselves in a better position to address these challenges as a result. Before we get too far into the specifics, let's take a quick look at some simple research surrounding the pandemic and the mental health of children and caregivers. So you remember back when you didn't know what COVID-19 was? I certainly do. I actually had a study on the go in Toronto at the time, looking at children's socio-emotional well-being in the context of early childhood education. This longitudinal study spanned from December 2019, so almost a year ago, to March 2020. And each child in this study was to be assessed by ECE, Early Childhood Educator Report, 3 times across that window. And if you recall, the pandemic was announced on March 11th, and we were kind of frantically able to finish the last point of data collection before the lockdown. So on the vertical axes of each graph, we have a standardized measure of children's mental health problems and difficulties in the classroom. And on the horizontal axes, we have days relative to the World Health Organization pandemic announcement date. For both outcomes here, we see increasing mental health problems for boys specifically, so the top panes, for boys specifically following the pandemic announcement. And this may actually be some of the earliest evidence of children's mental health deteriorating as a function of COVID-19. We're now following these children into the fall. So that study is back up and running. So what I showed you there is fairly limited in terms of follow-up. You know, it was just the very, very beginning of the pandemic. So let's look a little bit deeper into the pandemic. And what I have here are some rapid reviews from the University of Calgary. So in blue there, I have our best estimate of prevalence of all mental health problems in children and adolescents across the world. And the prevalence for that is that 13% of children across the world struggle with mental health problems. And in red, I have more recent studies since the pandemic that were included in this rapid review. A number of these were from China, given that that was kind of the first place where the lockdown was happening. And for the most part, these differences are pretty striking. So you can see there, I have the study author and the different dimension of mental health. So we're seeing both for the internalizing type symptoms like depression and anxiety, and also for the more externalizing symptoms, the kind of behavioral symptoms, such as irritability and anger. So in terms of prevalence, it looks like things are going up for children, and that probably doesn't come as a surprise to any of us. Moving over to adults, we have a similar review of studies. Again, before in blue and after in red, the pandemic. So before the pandemic, the prevalence of post-traumatic stress symptoms in the population was around 7%. That's a US study. In Canada, it's around 9% based on our most recent estimates. During the pandemic, we're seeing a prevalence of post-traumatic stress symptomatology that's essentially 1 in 4, which is absolutely remarkable. Just as a refresher, I've put on the right there the classic symptoms of post-traumatic stress that we see. And so maybe right now, for a second, we can just take a moment to acknowledge this time as a global collective trauma that is taking place before our very eyes. And this is corresponding to traumatic-like symptomatology in adults and caregivers. And finally, before moving on to these new results specifically, I just want to review some findings from the Ontario Parent Survey out of McMaster, which happened over the summer, about 7,000 caregivers in Ontario. And in Ontario specifically, 1 in 3 parents right now are reporting moderate to high levels of anxiety. And nearly 60% of caregivers are meeting criteria for depression based on a brief screener. I had a chance to talk to the authors of this study, Andrea Gonzalez at McMaster, and they were equally, I guess, kind of shocked and surprised that the prevalence rates of depression would be that high. And you know, that's not a mistake. That's kind of what we're talking about right now. In terms of the sorts of concerns that parents and caregivers are reporting, we're seeing kind of diverse concerns across the board. So challenges around remote learning in school, to screen time, to managing children's own difficulties with anxiety and stress, and their difficult behavior, and also just logistics around managing household routines and organization and meals. So these statistics here are wonderfully descriptive, and they stop short of describing the mechanisms through which the pandemic actually influences families. And that's what I'm going to discuss presently. So as we delve into this area, I'd like to take a brief moment to describe what we call the ecology of childhood, or the environmental influences on human development in general. For any of you who've done any formal training or education in childhood studies, this figure is likely bringing back some memories for you. This is the bioecological model of childhood development. And in this framework, we have multiple nested layers of influence, from broad sociological factors, such as like what our governments are doing right now, to schools and community resources, such as Erin Mills Connects, to families and to parent-child relationships, and then ultimately to the individual. And what I'm going to be describing is this cascade or ripple effect across these different layers that is resulting as a consequence of the pandemic. And just as a reminder, while this model is generally targeted towards children, it's also a life course model. So all of us on this call today were once children ourselves. So these are also the nested layers of influence that are influencing how we're doing in terms of our mental health and our well-being and working from home and coping with the pandemic. This will lead me into my discussion of influences of the pandemic on parent mental health specifically. So in order to study these influences, I launched an international study over the summer called the Cramped Families Study. We can take a minute to just appreciate that acronym. This is the Child Resilience and Managing Pandemic Emotional Distress in Family Studies. I'm sure many of us on the call today have been feeling cramped over the last few months. I certainly have. Today, we're going to be looking at data from the first 2 time points. I'm in the process of analyzing the data from September right now. And this sample consists of 549 caregivers who were the primary respondent and had 2 children between the ages of 5 and 18 years. The reason that I was focused on families with 2 children is because the study is also looking at sibling dynamics as well. On average, the younger child was around 10 and the older child was around 12. As our online recruitment partner was based in England, the majority of the sample is British. I understand England has gone back into lockdown. And you can see we have families in the US and a few in Canada and also Australia as well. I have additional demographics presented for you on the right. So the first thing I wanted to do, or I should say we, because this is a team study, we wanted to get a look at the types of stressors that families are experiencing related to COVID-19. 24 items were generated representing the problem, the common problems and challenges and stressors that families are experiencing as a result of the disruption that's taking place. Some examples are presented here. So like disruptions to finances, routines, supplies, and living spaces were indexed, in addition to the direct medical consequences of the pandemic. We can think about each of these items as a different M&M in a bowl, where caregivers who have more M&Ms in their bowl have higher levels of stress and adversity corresponding to COVID-19. Why M&Ms? Well, because of the statistical approach we took, I was able to reduce these data and figure out the dimensions in which the difficulties fall. So while I said previously that we have 24 stressors, we actually have 3 categories of stressors. This is an approach called factor analysis. The first stressor, or the first category of stressors, I should say, is related to economics and income. So decreases in income, taking on debt, mortgage problems, paying rent, etc. The second area of stress is related to these stress-induced disruptions in family life, such as there being more altercations, fighting with a partner, struggling with the kids and their behavior, or being separated from family members as a result of social distancing. Lastly, there is a dimension in yellow here related to the specific challenges presented by the pandemic. So I'm calling it like a COVID chaos dimension. Areas assessed by this dimension include accessing supplies, being isolated due to social distancing, overload of news and COVID news. I'm sure everybody's been watching news over the last 48 hours, given what's going on south of the border, and losing losing the family routine. And in this study, I used these COVID-19 disruptions to predict other areas of family life. If you take one thing away today, I would like it to be this slide, where I have summarized the results from a type of analysis, another type of analysis called path analysis. This analysis allows us to see the pathways through which the effects of stress operate. Another analogy we can use here is that of a cascading waterfall that spills over from one layer or level to the next. So when COVID-19 disruption is high, overall, families tend to be less patient with one another and more irritable. Consequently, children have higher levels of mental health problems, specifically in terms of depression, anxiety, and anger. In response to children's behavior being more difficult, parenting can become more reactive as we try to manage difficulties with kids, while also coping with the substantial stressors from the pandemic. The net result is an increase in caregiver mental health problems. This is where we got the title of the talk. Won't someone please think of the parents? So these analyses suggest that when we're working with children, we need to be considering how COVID-19 stress has influenced multiple dimensions of family life, including the relationships of everyone in the family and parenting and also caregiver mental health. Now, before I get into strategies, let's just take a bit of a closer look at the caregivers, okay? It may be beneficial from a clinical or applied public health and prevention standpoint to identify the caregivers who are most at risk for the stressors emanating from the pandemic. Two hypotheses formed our thinking here. The first we call the busy mom hypothesis. This comes from a lot of sociological work, decades of research, finding that female caregivers have a double burden, which leads to greater work-family conflict and role strain. Now, Statistics Canada tells us that this gap is shrinking. That is, men are doing more than they were 10 years ago and 20 years ago, but it's still far from equitable. So it's possible that the pandemic leads to an additional burden on female caregivers specifically, who are picking up a lot of the slack at home. And the second hypothesis comes from the idea of stress sensitization, which suggests that early life adversity can increase susceptibility to recent life stressors by lowering our stress tolerance or increasing stress reactivity, thereby amplifying the relative risk for mental health problems. And of course, there's also the possibility that these two hypotheses work in tandem, which is exactly what I set out to evaluate in the cramped sample. How do we think about early adversity in parents? So to be clear, right now we're talking about the adversity of parents when they were kids. The most common model here is called the Adverse Childhood Experiences model. A lot of you have probably heard of that, so this might be a bit of a review. The Adverse Childhood Experiences, or ACEs for short, are a set of difficult or harmful experiences that children might encounter while growing up. There have now been thousands and thousands of studies showing that more ACEs, as we call them, are associated with more mental health and physical health problems across the lifespan. This is how we thought about early adversity of parents in the cramped study. So next, we looked at parent mental health in 4 domains, and I have 4 different graphs representing those 4 domains. This is the most data-heavy slide that I'll be showing you today. So we have parental distress, which also includes depression in this current measurement configuration. We have anxiety, we have substance use, and we also have the traumatic stress symptoms. So women, in fact, reported higher distress or mental health symptomatology in every domain, with the exception of substance abuse or substance use, where men report higher symptoms. Next, I looked at mental health difficulties as a function of COVID-19 stress on the horizontal axis here. So that's our COVID-19 stress disruption scale. How many M&Ms are in your bowl of M&Ms? And in different colors, or different shades rather, I have ACEs presented. So in dark versus light lines, and they're presented for male and female caregivers in blue and red, respectively. Here's how the data look. So there are two patterns I want to point out in this slide. The first is that most of the lines are trending upward and to the right, in that when COVID-19 stress is higher, mental health problems are higher. The second is that the dark lines are generally higher than the light lines, specifically in regards to women with history of adversity. So that's the dark red lines we see up here, and up here, and up here. The exception is for substance use, where men who have early histories of adversity are using more substances. So to summarize, when women are stressed with COVID and have early adversity, they're reporting the most depression, anxiety, and post-traumatic stress. When men are stressed with COVID and have early adversity, they're using more substances. So what does this mean? When thinking about families during this time, it's not just about what's happening now, it's about what is happening now and how that may be exacerbating what was happening before. Okay? So what on earth did we do about it? Now that we know where we are, we can talk about where we're going. It's been wonderful to learn about what sorts of initiatives are happening in the region and at Erin Mills Connects. I forgot to mention I'm from the Kitchener-Waterloo area. I'm living in Burlington right now during the pandemic for kind of caregiving responsibilities. And in this section, I'm going to provide 4 suggestions, humbly, that I hope will be of some use to parents, educators, clinicians, and agencies. They're certainly the recommendations that I've been following during the pandemic. So as I review these suggestions, I'd like us to keep the cascade model in mind, this kind of spillover of stress. And in the same way that there can be a spillover or trickle down of stress, we can create a cascading effect of support and validation by acknowledging the stress that families are under and implementing strategies at these different levels of organization, from the individual, for those in a direct service role, and also, for parents and families, all the way up to the top, as is the case with agencies and community support. So we can think about mapping those efforts and those initiatives onto each of these domains. So in the same way that the challenges facing families right now are multi-level, our approaches to helping must also be multi-level. Okay, so on to the specific recommendations. First and foremost, I want to provide some space to discuss the importance of the oxygen mask principle. We might remember what it's like to be on an airplane. It's been a while for me. I still have a credit for Air Canada that I have no idea what I'm going to use. So that is, what are we told? We're told to put on your mask first. Now, I think it would be a bit presumptuous of me to provide specific recommendations in this domain, as everybody's so different, as are the things that bring them health and wellness. Also, this is not a self-help talk. So my recommendation here is that whatever was working for you before the pandemic, do that thing. If you can't do that anymore, be creative and find the next best thing. And I know that it is absolutely an immense challenge to find space to do that thing over time. For me, it's physical exercise. It's the first thing to go, and it's the most important thing for me during this pandemic. So while my recommendations here necessarily stop short of specifics, I'm saying this because I think in our emphasis on children's mental health during this COVID-19 season, we can run the risk of losing sight of parent mental health, and that ultimately, children require mentally healthy adults in their lives to do well. So, number one, put on your mask first. Number two, we want to prepare for ongoing disruption. To reinforce this principle, I thought some data from the COVID Schools Canada folks would kind of emphasize how serious the state of affairs is at this time. This is from Tuesday morning, so it's even higher now. We have 3,500 schools with COVID across the country, and the numbers have not leveled off in Ontario. As you can see in this blue line, it looks like they're starting to level off a little bit in Quebec. I was talking to Krista Gass again about what's going on locally, and these are the numbers for the region as of this morning. And we can see the darker blue, the more cases of COVID that are presently in schools. So my recommendations to all the families that I work with are have your short-term and long-term contingency plan in place regarding who is going to stay home, if alternative care is going to be made, or if it means talking to your employer. And I understand that many families have already probably been here since it's already, gosh, November 5th. And, report cards and parent interview season is already upon us. It's amazing how fast the time flies. My third recommendation is that parents and families reach out for help if they feel they might need it, and even better, before they think they need it. This is because it can take a few weeks to set up. Now, in this slide here, I've put up another review study, this time out of McMaster and Ryerson. And here, each of the black boxes represents a different study of online telehealth parenting support. Okay, these are randomized studies, so they're the highest quality evidence we have to date for online support for parents and children. The further the shapes are to the right of each little graph, the stronger the evidence that things work. So what's the takeaway from this slide here? It's that there's scientific evidence that online therapy works in terms of improving caregiver mental health and well-being, effective parenting practices, and also reducing children's mental health problems. So give it a try. There are a lot of folks out there who are providing this type of work, given what's been going on with the pandemic. It can make things more accessible in that you don't have to commute to an appointment. And it's certainly something that I've been involved with myself. And last but not least, I'll get a little more specific with this one. My final recommendation is to become an emotion coach. This is both for the loved ones in your life, so your children, your partner, if you have one, but also for yourself. Now, you remember from our cascade that the different aspects of family life are affected by COVID-19 through the spillover of emotion and stress from one area, such as the whole family dynamic, to other areas, such as children's mental health or your own mental health. So our approaches to dealing with these challenges need to focus on emotions. This perspective, which comes from emotion-focused family therapy, is where we consider emotions at the core of mental health. Mental health symptoms are seen as ways of trying to deal with and avoid negative emotions. So I might get angry to avoid the deep feeling of helplessness and hopelessness that I feel as a result of the pandemic. That's a safer response. For healing to take place, we need to hone in on these specific experiences, identify and name them, and allow for compassion. Allow for compassion in our loved ones and promote that, and also compassion for ourselves. Only then can we meet the needs that our emotions are communicating to us. My favorite saying in all of this is you have to feel it in order to heal it. So what might this look like? Just as children have coaches on the soccer field or in the hockey rink, any parent can become their child's emotion coach today. It involves 3 steps. So second kind of big takeaway for today is coming right now. First, we validate the emotion. We name it specifically, and provide justification for why it is normal and okay to feel that way. We don't try to explain the emotions away. That never works. Next, we try to meet the emotional need. The thinking here is that as every emotion conveys a need, such as wanting to be connected or wanting comfort, we can provide that need to either ourselves if we're doing this internally or to our loved ones out loud. Lastly, we can provide practical support, which can involve a redirection or problem solving or setting limits in the case of misbehavior. So let's do a little example here. In this particular example, you can see in my little figure on the right, we have a young girl who's sad she has to stay home from school due to some symptoms of sickness. An example of emotion coaching could be like this. So first, we validate. I might say, I imagine you're feeling sad because you have to stay home from school, and because you can't see your friends for a few days, and because it was right in the middle of an art project you really were enjoying. So we have 1, 2, 3 becauses. That's our goal. And note that we've also named the emotion of being sad. Next, we go to the emotional support. We might say something like, I want you to know that it's okay to feel this way. I'm so sorry that this is happening, and I'm here for you. So now we're connecting. We're connecting around that emotion. And lastly, we provide the practical support. So we might say something like, when you're ready, why don't we just go downstairs and get out those art supplies? We could work on your project together while listening to Frozen, one of my favorites. So I just want to clarify here that this is the exact same structure of communication that we recommend parents use for children of any age. Of course, you're going to change the language with a very young child versus, an adolescent, and also for couples. So for homework, if I may, I would like everyone to try using emotion coaching today, and if not today, this week. First by validating the emotion, then by providing the emotional support, and then by providing the practical support. And I want to just emphasize here that the most important step in all of this is the validation. We cannot skip ahead to problem solving, because then we convey to other people that we really don't understand how bad it is or how hard it is or how upsetting the situation is. First, we need to connect on that emotion, and then the rest follows. Yes, and this was just to describe that it can work in a variety of different relationships in your life. So I've been talking for about 45 minutes, and I'd like to conclude today by going back to the Jensen Ramirez family. So at the advice of a friend, Helena reached out to a psychologist who specialized in working with families. She was worried about the expense, but was able to get in touch with a community clinic that offered a very, very reasonable sliding scale. The whole family attended for 8 one-hour weekly sessions virtually. This provided a space for the family to process the difficult emotions that have been corresponding to the changes as of late. Victor and Helena learned about becoming emotion coaches for Mary and Louisa, and learned that the discussion of emotions in their own relationship had rekindled that sense of closeness and intimacy that they haven't been feeling. This led to Helena talking to Victor about his drinking, and Victor letting Helena know that he felt kind of ignored and lonely. While things are still hard, we're still in the pandemic, and the girls certainly miss their friends, their difficult behaviors have significantly reduced. The family, incidentally, still plans on going for their weekly outings to the park throughout the winter months, well bundled up, no doubt. So coming full circle back to our learning objectives, I just want to highlight these kind of key takeaway points. So number 1, COVID-19 stress gets inside families by creating this emotional climate that derails relationships and spills across different domains of family life. Secondly, COVID-19 stressors do not exist in a vacuum. They're additive with the effects of early life adversity. And lastly, following from our first 2 points, our clinical and service approaches must be considerate of the way in which these stressors emanate across the entirety of the family system. A few thank yous are in order here, especially to my lab manager, Shaylin May, and my funders for this work. Most importantly, thank you to you, everyone in attendance today, also to Carol and Catherine and Krista for setting this up. And with that, I'm going to put up my personal contact info if you have any questions, and also the info for our non-for-profit campus clinic, where we're providing telehealth services for children and families, and presently there's absolutely no wait list. So why don't we set it up for questions and comments.
Hi, Dillon.
Hi, Krista.
I just wanted to say, like, brilliant talk today, and it's really amazing that you have data to speak to the impact of COVID so early on. So kudos to you for publishing in the middle of a pandemic. That's excellent. So my question is really around, for those of us who are service providers to children, maybe working in the school system, if I were to kind of take your data and extrapolate it to our work, it sounds like now is the time to be expressly careful about childhood diagnosis of mental health problems, knowing there's this cascading effect, and the impact of COVID is really going through parenting and the impact on parents, and being really cautious in our assessments to ensure that we're really looking at the whole family system when we're trying to get a picture of childhood functioning at this time, you know, especially when in, say, school systems, we're very focused on the particular student. Now is the time to really expand that assessment and be really looking at the family. Would you comment on that?
Yeah, absolutely. And I'll go back to our kind of ecology of childhood slide here. Maybe that would be a framework upon which we can scaffold our thinking. So yeah, when we're working in the context of schools, I have worked in school contexts in my own career as well. And because of the nature of the work and the setting of the work, we're often seeing a child. And in some instances, it can be really difficult to get family engagement or to get parent engagement, just due to the simple logistics of making phone contacts and communicating with caregivers who are like doubly burdened right now with all the stuff that's going on in their lives with work and finances and so on and so forth. So even if we're not able to necessarily work with families, we can still use this kind of ecological model to inform our thinking and really understand that at this moment in history, this very unique moment in history, we have a universal stressor, as you see on the left here, of COVID-19, that's hitting different levels of the ecology, all the way from the individual child up to the sorts of policies and system level responses that we're seeing with our governments right now. So yes, if we are seeing a child who is presenting to us in our clinical work, who is having higher levels of anxiety and stress, you know, maybe in February of this year, we might have had a more clinical diagnostic lens around that because, you know, for all intents and purposes, there wasn't this macro stressor. I would argue that in reality, there probably is this ecological influence happening as well, because we know that children's mental health problems and family functioning are inherently interrelated. And I think to reiterate your point there, Krista, is that I think now is especially the time to be thinking in terms of the developmental system, and that we know that most children are having some kind of added stress-related disruption in their lives, you know, from having to wear a mask at school or doing online schooling or having disruptions in school related to classrooms closing, and also, you know, going out in the model to the way that families might be relating to one another at the time. So I think in terms of writing reports and the formulation sections of our reports, we really do want to think more than ever about those environmental influences. And that might mean either providing a provisional diagnosis or not providing a diagnosis, at least in terms of socio-emotional and also in terms of learning outcomes at this time, without some sort of response to intervention framework, or waiting to see if we can, maybe get some juice in the tank for the family, or try and redress some of those challenges that are happening systemically, in order to see if those difficulties remove right now. So I think, yeah, it's time to be expansive in our systemic formulation. Does that kind of get at what you're talking about, Krista?
Yeah, thanks, Dillon. It's actually really confirmatory, I think, in the way we've been thinking about it. And your presentation today really gives us some current data to really take back and justify some of those different ways of working. Not that it's all that different. I think we should always be using a family systems approach, but maybe now more than ever, and having some data to say maybe we need to work differently during this time, and here's why. So
yeah,
thank you.
Yeah, thank you, Krista.